As an orthopedic surgeon, I've performed thousands of total knee replacements and have seen firsthand the advantages of robotic-assisted surgery over conventional methods, both intraoperatively and in patient outcomes following surgery. There's absolutely no doubt that robotic total knee arthroplasty is setting a new standard for what patients can expect following a knee replacement. The most significant advantage of robotic-assisted TKA lies in its ability to deliver unparalleled surgical precision and personalized joint alignment. And here's what I mean by that. The robot allows us to create an intraoperative 3D model of your knee that maps your individual anatomy in real time during surgery. This allows us to plan implant positioning with extreme accuracy and adjust on the fly based on soft tissue tension, bony geometry, and your unique wear pattern created by arthritis, minimizing the risk of over-resection or imbalance. This precision directly impacts probably the most critical variable in knee replacement success. That is implant alignment and soft tissue balance. Even small deviations in alignment can accelerate implant wear or lead to poor functional results following surgery because the implant wasn't placed in a position to recreate your natural anatomy. So what does this mean for you as the patient? In my experience, and supported by some of the early research, robotic TKA often leads to improved gait mechanics and better early range of motion, less pain in the first few weeks after surgery, and higher satisfaction scores early in the recovery phase following surgery. This matters, especially for patients who are younger, more active, or just want to get back to life as quickly and confidently as possible. You're walking and driving sooner, getting back to work faster, and returning to recreational activities like golf, tennis, and skiing with a higher level of trust in your knee. And this is the stuff that matters. Robotic knee replacement isn't just a tech upgrade, it's a smarter, more refined way to do the operation. I use the robot for every one of my knee replacement surgeries because in my opinion, it truly is a surgical game changer. If you're considering a knee replacement and want to know whether you're a good candidate for a robotic total knee, check out some of our other videos and give us a call if you'd like me to walk through the process with you in person.